That issue across the state. Yeah.
I hadn't heard until it was kind of bought forward. But yeah, they sold it.
I wonder if it's everywhere.
It's everyone in the city. They sold it for like $3. Okay. That should be the case.
When I was
Oh,
available,
that's the best.
gave access to everything. Do all the analysis. Okay, like, oh, it's.
But it looks.
And teaching leadership, they're really
True. And the devil.
so.
We're not gatekeeping this.
If you need more people. Conversation. I'm on to you, but.
You guys come out.
Yeah.
That contract, did you see it?
My gosh.
We get a refill.
Right. We're gonna try our best to make sure that we stay on time today, and I see all you churchgoers in the back row. There's only so many seats back there. I am State Senator Catherine Ingram from the 9th District, which is down in Hamilton County. Some people say I'm actually in Kentucky.
She is.
Welcome. Welcome this morning to each and every one of you. And hopefully today, since it is our inaugural summit, that we'll be seeing one another year after year and solving all of these issues that we have. And the more you hear a story, I should turn my mic on. The more you hear a story, the more you go, we should do something about that. We can do something about that. We've been working to do something about that for a long time. And so I'm very proud of some of the work that's going on in Ohio, especially considering how far away we were from real goals, real thoughtfulness about the importance of our maternal health, our infant mortality rate, and all of those things that unfortunately have been in the negative. So thank you so much for being here this morning. It's kind of chilly and somebody's complaining it's cold in the room. Whatever complaint you have, make sure you take it to Senator Hicks Hudson and she'll be able to help you. So having said that, I'm going to turn it over to Senator Hicks Hudson.
My colleague and I are twins in many ways. Twins in the fact that we come from two separate parts of the state of Ohio. I represent Senate District 11, which is in Lucas County. Woo-hoo! And we are so excited to have this day finally come. It has been a journey, but as you know, it is a journey well worth taking. And we're here to listen, to exchange ideas, and really to arm ourselves as legislators to move forward with this mission, which is to make sure that every Black mom who has a pregnancy is going to be successful. And every infant, Black, brown, white, will have a successful life here in the state of Ohio. But this, as you can tell in this pamphlet, we started in 2019, but the journey really started even before then. And the state has continued to evolve. So we're hoping that this inaugural event will be one in which we will continue that evolution. And with that, I'm going to turn it over to our mistress of ceremonies, who will come forward and will take over and do all the wonderful things that we need done.
Former State Representative Shayla Davis.
Good morning, everyone. And let me just say this. I had the pleasure of serving in the House with both Senator Hicks Hudson and Senator Ingram. And as the MC, I was supposed to start first, but when you work with these two ladies, they're going to get up here and do their own thing, right? I was going to introduce them. I had this wonderful speech and they were going to come up, but here we are. It's okay. I really just want to thank them for having the vision to bring the Black Maternal Health Caucus together for the state of Ohio, because many of you in the room, especially the practitioners who are doing the work, understand the value and the importance of our Black babies surviving, all babies, but more importantly, here in Ohio, our Black babies surviving. So thank you guys for the work that you do in being here today. I would also just like to share that both of these ladies have been very inspirational to me throughout my career for my time in the legislature, and now as the president and CEO of the Ohio Legislative Black Caucus Foundation, where I serve the entire state of Ohio. It's not the caucus, we're the nonprofit 501c3, looking to empower Black people across the state of Ohio to ensure that there are effective policies, and we're doing the work from the outside in. So thank you all for being here this morning. And I now have the pleasure of introducing Director Kara Wente. You will hear from a leader who has dedicated her career to strengthening Ohio systems for children, for the care of children and families. Director Kara Wente serves as the director of the Ohio Department of Children and Youth and has led initiatives to support vulnerable families across the state of Ohio. It is my honor to welcome Director Kara Wente to the stage. Thank you.
Thank you. It is a pleasure to be here. I cannot thank the fine senators in front for pulling us together enough. I think two things that I'll start with. One, I am the director for the Department of Children and Youth. I joke I'm the best director we've ever had. I'm also the only one we've ever had, so I can only use that for a while, but hopefully a long while. And I just want to thank you all for being here for such an important topic. Someone told me a long time ago, and the senator hit on this morning, that we have to talk about these topics over and over because it takes someone 7 times to understand it and 14 times to act. And I remind myself of that often because I feel like I say the same things and people are tired of hearing our goals and they're tired of hearing about how we're trying to align and streamline programs and find moms. But I have to keep saying it because we haven't received and seen the traction and momentum that we need to make real change. But the good news is we're starting to. For the first time in 20 years, Ohio has the lowest infant mortality rate we've realized. That's a huge win. That's a true testament to many of you in this room. You're working hard in your communities, you're building your rapport with families, but most importantly, you're listening. And that is our commitment at the Department of Children and Youth. I have the benefit, I never have to be the smartest person in the room, which would rarely ever happen anyway. But in all honesty, it's because we fill our rooms with families, with people with lived experience, with our youth who have lived it, seen it, walked in the shoes of others. And that's who we're listening to. That's our commitment. That's what we started with day one. We've built it into our infrastructure, and we are going to ensure that we continue to listen to the communities. We cannot program our way out of this. We know that. We've set a solid foundation. We have great investments thanks to the General Assembly, the representatives, the senators have supported us. We do need programming, but we have a solid start. We now need to make sure that we're making the connections, that they can actually leverage the programs that are so important. I had a great conversation a couple weeks ago with a member who said, we have supported everything you've asked, yet I continue to hear how bad we're doing. I said, no, we've set a foundation and we're starting to see traction. We're starting to see the community connections, but we have to make sure we're breaking down those barriers to actually accessing Medicaid, to getting to those well visits, to making sure they have nutrition and housing. And those are the conversations that are so important that you all continue to have. So what I really wanted to do is say thank you. First and foremost for your time, because that is your most precious commodity. The second piece is for listening and being patient as we continue to evolve as a system and as a state. We are seeing these valuable investments, but it takes time. And our other commitment outside of listening is to make sure that we're monitoring. I have a nephew that I like to describe as all gas, no brakes. And I say that because when you see something that's working, lean in. We have seen that in communities where we're starting to see the tide shift. You guys have on your agenda later today, the model from Cradle Cincinnati. We know there's great work happening in Columbus and in Cleveland and across the state and other areas as well. Where models are working, we need to invest. And that's where we're going to see the biggest change. So we are going to monitor though, and make sure that we're holding ourselves accountable to seeing and realizing a difference for our kids and our families. And when we do that, we lean in. When we don't, we're willing to adjust. So as we have said, I think since the beginning of the department, our ongoing commitment is being here with you, listening to the experts in the room, trying to tell your story so that more people can hear it, and then making sure that we are putting our money where our mouth is, and that we are continuing to hold ourselves accountable. I can't thank you guys enough for being here. We appreciate the support we have had across the board at the new department. We have several large investments that we are continuing to talk about through the state budget process. I know the members may feel like they were supposed to be off this week, but we of course take every opportunity to say, we know that investing early has the biggest return. And you will see that highlighted in the Department of Children and Youth budget. And we hope that we can continue to partner with you all in the year to come to see true transition, and that this rate that we have today, the rate that we have at the lowest in 20 years, is just the starting point. The best, I think, is yet to come for our kids and families. And I know Governor DeWine's committed to that. We're committed to that. And we certainly appreciate that all of you are as well. Thank you and have a wonderful day. I know you're going to learn a lot, and we are excited to be here with you.
Thank you, Director Wente, for those very impactful words and for the work that you do for families across Ohio. And in this room, we're going to say you are the best director, right?
Thank you.
We will go with that. Okay, now we're going to move into policy. And I get really excited about this because, as I stated and Senator Ingram stated, I'm a former legislator. So I have the pleasure of introducing three of our panelists as we go into our legislative discussion and panel conversation. I'm very excited to introduce State Representative Cedric Denson from Cincinnati's 26th District. He is a third-generation Cincinnatian and advocate for public health. I was gonna call you guys up separately, but come on, legislators, come on up. That's okay. Come up, Holmes, come up, Lawson, Rowe, and Mr. Denson. Good morning. Thank you guys for being here. Appreciate you so much. And then I'll start over with your bios, folks.
No, let's start over. Let's go from third generation, raise your hand. Okay.
I'm gonna listen to Ingram this morning, okay? So he is a third generation Cincinnatian and advocate for public health, and also my personal friend who I really value and appreciate. He currently leads the regional efforts of the Ohio Environmental Council and has been instrumental in addressing infant mortality. We built a very strong friendship over the last several years in the House. He's a passionate advocate for public health, and it is his heart for this work that I deeply respect and honor. So thank you for your leadership in being here today. Next, I will introduce Representative Meredith Lawson Rowe. She and I first connected back in 2019 as members of a statewide cohort of Black women councilwomen during the pandemic, a very crazy time. And the only way we could connect is virtually so that we could ensure that we were showing up and serving our communities. That network was born and this relationship has been established. And now she gets to represent the 5th District, where she brings experience from Reynoldsburg City Council and her community organizing. She's a founding force behind the Reynoldsburg Juneteenth celebration and a champion for racial and health equity. So thank you so much for all that you do in being here. And last but not least, I'm going to introduce Representative Adam Holmes. While I didn't get to directly work with him, we've had some wonderful conversations. He plays a key role as the co-chair of the Joint Medicaid Oversight Committee and brings both business and military leadership to this conversation. His contributions to healthcare policy are important to today's dialogue. Representative Holmes from the 97th District is a Marine Corps veteran and business leader. His focus on healthcare delivery systems is key in this discussion today. So thank you so much for your time and being here. Now let's just roll right into the questions that all the people in the audience want to know from the legislators. So this is how we will open it up. And I'll start from the far left and just work our way back. How does your current legislative priorities align with the mission of improving health outcomes for mothers and children in Ohio? That is for Representative Holmes.
Yes, thank you. That's perfect. Thank you for inviting me. It's a privilege to be here. Feels good. The leaders that have impacted me, watching you in the State House. And I've been a member of the Black Maternal Health Caucus now for over 2 years due to the leadership example. And so my personal role is chairman this year, and we switch between the Senate and the House of Joint Medicaid Oversight Committee. And Medicaid as a program, and the discussions I've already had with a lot of you on that program, and it's huge, right? 50% of our budget. So for me to understand, to be given that job, which I had no experience in Medicaid before coming to the legislature. I went back to the roots of it and how it started, Lyndon Baines Johnson's administration, right, in 1964, along with the Civil Rights Act, things that he did. And one of the things that we talked about is when at its start, pregnant moms were the specific target for Medicaid. And it started of taking care of them, those that were most in need. That was the intent the whole time. And when I think about how massive Medicaid has become, I'm frustrated that those that it was designed for have not received the focus all the time. And so from my chair, that's kind of the role we've taken, is to go back and look at that and recognizing that this commonality in Ohio, we love babies, right? And many of you said that to me before coming in, and reemphasizing that and finding that unity and making Medicaid ensure that we meet the mission and intent of it, and tailor it to that extent. Recognize that also, and then I'll stop talking here, that Black infant mortality was an outlier, and that's uncomfortable for me. Recognizing that we don't have something right in the process, and finding a way to fix that. And certainly my history, and that'll probably come up later, as a Marine Corps officer, and that unity of an organization, that it should be. That's a problem, and understanding why that is and solving it. That's really been a focus as chair of Medicaid on looking at that answer. So if that answers your question, that's as close as I can get for now. Yeah.
No, thank you. So what I took away from that is that this was new for you, but you're invested and interested in learning from Ohioans on what can be done better to ensure that Medicaid is operating and really focused on what its original purpose was. And that's what we're here to talk about today.
Right. And Director Winthy, well, she's great. She's another best one we've ever had, right? But then the intent of the governor to create her position, right? And install her as a great leader. And we have the programming, and we certainly have money in Medicaid. So source to need, what are we not doing right in the program? What's that to help? And so I'm fascinated by it. And so I have learned a lot. This is my 7th year in the State House, and it takes some time. I saw the phrase wicked problem. That's probably the right way to phrase that, of unraveling that. So yes, ma'am, that's where I'm at.
Thank you. Thank you so much. Same question. I'm going to turn that over to Representative Meredith Lofton-Rowe. How does your current legislative priorities align with the mission of improving health outcomes for mothers and children in Ohio?
Thank you. Good morning, everyone. It is an honor and a privilege to be here this morning. When I first learned about this event, this summit, I planned on attending and was so excited because I'm in the room with so many giants, in the room with leaders who I look up to, and to actually be seated here in between two senior legislators. I'm pulling my freshman card and I have my notes because I'm a little nervous. But in terms of the work that I'm putting forth that address Black maternal health, I say that it's indirective. So first and foremost, I'm very proud to share that one of the first pieces of legislation I dropped was bipartisan, and that was to designate February 14th as Cardiovascular Health Awareness Day. And you're wondering, what does that have to do with Black maternal health? Well, cardiovascular health, we know, is one of the main killers of women, and it particularly affects our Black community. So that is very important. In other ways, my legislative work is addressing Black maternal health and infant mortality is around access to affordable housing and healthy housing. So if we as a family, we as mothers have healthy housing and we have a safe place to call home to care for our children, I think that's the foundation and we must build upon that. So the legislation is source of income housing, and that's to prohibit income discrimination in housing for those of us that are looking to rent housing, and to create an eviction defense fund and provide legal representation for neighbors who are facing eviction proceedings. Thank you.
Thank you very much. Rep. Jensen, should I repeat the question or you have it?
I think I got it. Good morning, everyone. It's a pleasure to be here with you. Special thanks to Senator Hudson and Senator Ingram for putting this together. I'm always talking about this conversation. I always say, where are the men in the room? Because a man probably got that woman pregnant. So we need to all be having a conversation. So I'm glad to see this come together and be a part of the conversation today. Minus legislation is sort of indirect as well, but it's taking care of the whole family. In the last General Assembly, I learned that Black women are getting breast cancer at a much higher rate. And we figured out most Black women have dense breast tissue. And when you have dense breast tissue, you need a special test called the total synthesis test, which is basically a fancy word, but it's just a 3D test that actually detects if breast cancer is there. And we were able to get that bill across the finish line to the point where we were seeing people find out that they had this dense breast tissue and they would get a letter in the mail, and the language in the letter, it was kind of hard to read. If you took another step to figure out what it meant, you would go, and in some cases you would find out, oh, I can't afford the test, and then you end up down the line with breast cancer. So we were able to get it across the line that now that test was going to be paid for by your health insurance. Well, we thought we got it across the line, and we did, but then we started to get calls after it hit the governor's desk that the insurance companies weren't paying for it. They had found another way around. So this General Assembly, we are now working, and we're just about there, on reintroducing some language that is going to strengthen to make sure that those tests are taken care of by your health providers. So that's something that we're doing that is health related, but of course, taking care of the whole mom.
I had 2 saved rounds. Is that okay? Because you're right. You're right. This on priority. I'm on the Ohio Commission for Fatherhood. And there again, kudos to our state for creating that. And I saw your shirt. I saw your shirt, your t-shirt. And there again, we as men, I'm thinking that's another thing that can be additive, is how we can encourage men to be additive. And I don't have any data, but I just think that men can create stability and security for a young mom. And that's gotta be a health factor. And I really believe in that, and a role for men. And just what you've all said is, this is the inaugural, but you're gathering good people that are gonna come in and that kind of concept to really support family as we can. It's so important, but I can't define it, and that's another reason. And then the other, legislation, we're going to have Ohio Stillbirth Day.
Mm-hmm.
Senator Coonsey started that and getting that going with Cecil Thomas and Senator Craig. Yep, Herschel Craig. So good men, really good men. And that's going to happen. And if you've seen that, that's going to be probably when we come back. The governor's going to get that as soon as possible in April or May to sign that. And Pastor Mike Bullock and his daughter Jennifer, who's Channel 4 News, have been advocates for that. And she's gotten really personal about the issues of stillbirth and maternal health. And she's done a 30-minute presentation this past week, that Channel 4 News let her do that, to have an interview on that issue. So I do believe, yeah, 7 and 14, but if we keep beating that message, it grows and grows and grows, and we're on our way, and that's a legislative priority.
Thank you. Thank you all for that. Now I'm going to get into a much deeper question that I think is pressing for all Ohioans right now. We're talking about the budget, right? And that's been the contention and conversation we've heard over the last 10 to 12 days. So my question, I'm going to start with Representative Denson here. The Ohio House Main Operating Budget Omnibus Sub-Bill passed April 1. It included significant cuts to maternal and child health program. What concerns do you have regarding the $1,000 child tax credit, the Lead Safe Home and Lead Abatement programs, the Medicaid funded doula services, and the Infant Vitality Network? Or what other concerns in general related to this bill as it pertains to Black maternal health, mothers and babies across Ohio, are most pressing and concerning for you?
I mean, I think all of those that you mentioned are important, but I mean, the reality of this budget is that we've all seen the good, bad, and the ugly of it. I didn't support the budget, but when you bring up all of those things, call and mess with the senators over here. I think this is our only chance to really fix the things that are important and spend some time on them. So reach out to them and talk to them about those things, because I don't have any faith in us putting things back the way they should be in the House.
Thank you. Representative Lawson Rowe.
Thank you. I simply say that the fight's not over, that we have to call our senators, we have to call the chair of the Senate Finance Committee, Senator Jerry Serino, and we have to contact the Senate President, Senator Rob McCauley. And we have to ask our senators if they will fight for us to restore what it is that Governor DeWine had put forth in the budget. While that's not perfect, his baseline is far different than where we are now. And so I just say that the fight's not over. Call your senator. If your senator is like our lovely senators here, we know that they're on our side, but find out who are the senators that you need to speak with that don't quite understand what our fight is today.
Thank you for that. Thank you so much. Representative Holmes.
Right, that is good, bad, and ugly. The budget is enormous, right? And it comes in, and many of those things we have to vote on that we had no influence on. But I'm also recognizing the value of a bicameral, right, House and Senate, because you build something and then you vote on it, and it's still fairly rush what we did. And once you see those impacts and community response and constituent response, there's another bite at the apple, and that's what that's for. The Senate is, I'm sure, more astute and deliberate as they're over there, and only 33 of them, right, to really look at those issues. Doula, it took a long time to get that in previously, so I'm not sure why that was taken out. Here's the advice. What really always wins with dollars is measured effectiveness. If you can show this, the dollar spent on this program saved lives, this many lives, to be able to build those cases, that's indisputable. And we have the money, like we said, and we have the programming, so that just better alignment and reinforcing success. I mean, I wish I had better data, but I'm intuitively the doula program saved lives. But how do we collectively prove that? How can we show people who aren't familiar with it that this is good investment in dollars? That's the key.
And Rep. Holmes, I would like for you to restate what you said, because I think for the providers in the room, they really need to hear that, because actually that's an advocacy strategy. And you talked about being able to show the impact through the dollar. So if you could restate that, because I think everybody should write that down as a note. If you don't realize how important and valuable that is as you're advocating and talking to your state legislators, this is a key point that needs to be made in your storytelling.
Right, that business concept of return on investment. So in exchange for these number of public dollars that you gave us, what we gave you is this many saved lives. And you can come to committees and who are just trying to manage dollars across everything from highways to, you know, to schools, to property tax, that carries the day. And it's worth it. Again, every legislator loves children and will support babies. So that will ring a tone in any legislator that you're saving lives with the dollars you give. That's an effective strategy.
Thank you. Thank you for that. My next question, and I'm going to start in the middle here with the only lady that we have sitting here at the table. What advocacy strategies, as we're kind of leading into that, can community organizations use to influence policy before a bill is introduced? Or I'll make it a little more personal. What do you need from providers, from your constituency who's calling your office to get you to hear them, to receive the help that they need to be able to do the great work that they do, because they are the experts at doing the work?
Thank you for that. I heard earlier it takes 7 times for us to hear a message in order for it to resonate with us. Don't change the message. Continue repeating yourself, repeating that message. Continue collaborating with the organizations that are here represented today. And share the lived experiences. Representative just shared about showing how dollars are saving lives. There's so many of us that we love babies, but we don't know the story. I'm saying I know the story. I have a lived experience. I have a daughter-in-law that has a lived experience. But oftentimes we don't share our lived experience because we think, oh, that just happened to me. Oh, that's really not important. Well, it is important. We need you to please share your stories because I can't be in relationship with you. I can't advocate for you unless you are in relationship and you are sharing your story. And in order for us to be in relationship and for you to trust me, in order to advocate and share your story, I must hear it so that I can regurgitate what your lived experience is, because there's so many of us, and being the only woman on the panel, I'm sure my colleagues would share, they have absolutely no idea what it's like to go to the doctor and the doctor may not believe what your symptoms are, or they may not understand how many times you've had to advocate for X, Y, and Z. And by the 7th time, someone is finally listening. So I would leave with you to collaborate with other organizations because we're all fighting that same big, hairy monster of infant mortality. Collaborate, share your stories, and share it many times over and over, even if it's the same story.
Thank you, Representative Lawson Rose. So what I heard her say is that you all need to flood her voicemail, right? That's what I heard.
Send me emails, send me smoke signals, come to my office, all of that, and I'll tell you who to talk to.
Representative Denson, that question now is over to you. What is the best approach for outsiders, for Ohioans to really be able to reach you to influence policy before it's even introduced?
That's a long question. I think a little bit of what everybody said, because there's no perfect way to do this massive state budget, and it then has to translate to you all as providers and your advocacy, getting those dollars into the budget. I think one of the main things you do is what he talked about earlier is you make sure that you're telling the story of those dollars and the lives that it's changing. But when you do that, you know, all the providers in the room, come up with one message if you all could, even being different organizations. Come up with one message because it makes it easier for us to understand and make that message loud and make it bold. And I always tell this story about, you know, sometimes when you feel like everything's not on your side for the direction you want something to go. And committee wants, there was something that was happening then, a group in Cleveland. Any Clevelanders in the room? Cleveland, they showed up. See, that's how y'all came, real loud. Cleveland showed up and there was a bill and it was not a good bill in my opinion. But because they organized so fast and they had one message, the chair stopped the meeting and went and worked with the opposite side and came up with an amendment that made that bill a little bit better. And so when you think about advocacy and you always say, well, how much do the calls really matter? How much do the emails really matter? How much does showing up, giving testimony matters? How much does written testimony matters? And I say all of the above, it all matters. It all being compounded together, it makes it really hard for us to ignore those things. And again, it may not get you where you want to be, but if it's organized and it's a clear and concise message, I think it gets you closer to the goal line.
Great advice. Thank you so much.
Yes, ma'am. And here's something else I've learned from working with all of you is how big the community is, but winning ideas that are in one spot translated and getting those best practices communicated to other areas. I'm trying to think of the last year in JMOC, we talked about infant mortality. We had a whole session, a hearing on that, but there was an organization in Cincinnati that had some really innovative practices that were unique to them. And so communication in this caucus of a winning model. And if everybody starts talking about that winning model and you 14 times, 400, you know, that's how things change in the American process. But they're out there of unique victories that you've had on combating infant mortality rates. And that wins too. And then just what you said, if everybody speaks to that winning message, you can push something through just the total cacophony of voices that come to our offices, right, as we're coming in.
Thank you for that. So what I heard in all of that for everyone in the room is that great collaboration matters. And we are in a time today where collaboration is very critical. We cannot operate as individuals. Your idea may be the best one, but bring it to 5 or 6 other folks so that we're all having the same message. I'm not a panelist, but I needed to share that. Thank you. And so now I will go into my last question. Are there any emerging or less known proposals that could impact maternal and infant health in Ohio? Rep. Jensen, back to
Oh,
you.
wait, I gotta look at my notes. Can you go
Okay,
to
I'm
somebody else?
gonna jump over to Rep. Holmes then. I'll take it back to you first.
Yes, this has been interesting, and Jennifer Bullock has really helped me understand this, that in Nationwide Children's Hospital of the extraordinary technology they have to save lives of infants in the NICU, but they don't necessarily target prenatal issues. They have the equipment and the hardware, but not really, and they probably have the technology to focus on at-risk moms for infant mortality, but they haven't really focused resources on that specifically. And then also more analysis when a birth doesn't work the way we want, of really gathering data on that to understand what actually happened. So I think that's going to be the next focus. We have enough money and resources, but maybe we're not focused on the right portion of that. I think that's going to be a future because they want it too. I'm so impressed with that hospital, and they've impacted me. And then the last thing I would say is to get that change, same messages from different messengers. Let's just say it who I'm not your standard, right? But that's okay because we are all the same. And when you start having different areas speak the same message, that's a winner too.
Rep. Laughlin Rowe.
Thank you. Postpartum is real. And I believe if we have some sort of mandate where there's a screening across the board, both during prenatal and postpartum visits, that could create a baseline. And then thinking outside of the box, paid family leave on a state level. If we have time to bond with our families, with our baby, we're paid, we don't have to worry about, I need to get back to work, and the baby's only four weeks old, or paid family leave, including our husbands, our significant others, so that they're home with us to help the mother. We can get to doctor's appointments and not have to worry about childcare for our older children. Our husbands, our significant others can be there to help support us during that healing time. We can get our babies to the doctors, we can get ourselves to the doctors, we can take care of ourselves. So paid family leave on the state level and mandating screenings, I think are two approaches that will help give us synergy.
Rep Denson, last but not least.
Well, you said everything I wanted to say, but I'll,
Same message.
same message. But I think I'll just end by saying that with all of these things being so important, not only just during budget time, but another thing you can do is spend time educating us. And I'll just bluntly say, especially the men in the House and in the Senate, because we don't know a lot of the things that go into pregnancy from beginning to end. And I think the more time you can come together again with that message and do advocacy days together with everybody, it educates us in a better way, because sometimes when you don't understand something and the budget is moving fast and you hear about it, it's like, what does that even mean? And it just doesn't get the attention it means. But this work that you all are doing in this room is extremely important. And you have outcomes. Tell those stories and make sure that you are, again, educating us from beginning to end on what this experience is like, because at the end of the day, we want healthy families in Ohio.
Thank you. And then I just want to add that I think it's so important for you guys to, when you look at the budget and you think about these larger hospital systems, think about our FQHCs, think about our smaller clinics. We're providing services where people in the community feel safe, right? And they're afraid, honestly, to go to these larger hospital systems because, to your point, Rep. Lawson, Meredith Lawson Rowe, I always have to say your whole name to get it right, that they feel like they haven't been heard. It's been 7 times that they've complained about an issue and situation. And so while the larger hospitals, and I'm not denouncing them in any way, they're great and they do great work, but there are much smaller places and folk who have that very intimate relationship to make that mom feel very safe. And that has a great impact on the outcome of that baby being born alive and making it past its first birthday. I just wanted to add that. But thank you guys for your candor, your time, and your leadership. I believe this will be an ongoing conversation. It's not just about the budget. As Rep. Denson said, continue to reach out to your legislators. If you're afraid, find someone who is an advocate or who is vocal. Sounds like us Cleveland folk really are. Call and ask us to reach out. Well, Toledo too, Rep. Hicks. All of those things are very critical and important. It's not that just the budget, it's the relationship building, so that folk understand and know exactly who you are, what you're fighting for, and what we stand for. So thank you guys for being here. I will now hand this podium over to Rep. Ingram, Senator Ingram. I'm sorry.
Don't give me the podium. I don't want it. Actually, I'm not next on your agenda. Thank you guys so much. But it's important what they just said, and it's not just about this particular budget. And unfortunately, so many other things in other areas in the budget impact the family and the mother. So it was very important when the governor talked about the Department of Children and Youth, and then what would be under the Department of Children and Youth, that we say, wait a minute, What's that gonna do for daycare? Wait a minute, what's that gonna do for whoever's on Jobs and Family Services and receiving those services as an adult able to impact their children? So right now, there's lots of things that are happening that I think that what I'm most excited about is that there is a collaboration more so now than ever, because folks start to realize we're in this game together. And we're all talking about the same people. So it's the same group of kids, same group of mothers. What I want to do, I want you to start to think about when you're talking to us though, especially in light of the controversy I see over the DEI, which unfortunately has become a bad word. Not even a word, it's an acronym. DEI is an acronym, folks. But I want to make sure that we're looking at it and trying to stay above the fray. So I would like you to think about the Black Maternal Health Caucus as the focused maternal health caucus, which then allows us to focus on what we need to focus on, which unfortunately, our Black mothers and our Black babies are dying at a higher rate. And so therefore that focus will be on everybody, except that we will narrow that down to the population that needs it the most. So be thinking about that when you start to think about as we move forward. I hope that our panelists didn't leave because they were talking about something that they can hear about later. But right now I'm going to give it back to you so you can introduce our speaker.
Thank you. Thank you, Senator. Yeah, can someone go in the hall and make sure they didn't leave? Because we do need them to hear, right? Because they're making the laws and the policies. At this time, I am very excited, not only excited, but honored to introduce your keynote speaker for today. I have great joy in doing this. She is a mentor and a friend. This is former Senator Charlita Tavares. I'm sure everyone in this room already knows her name, and if you don't, you will understand and know why today. She is here to speak to us as a trailblazing public servant, but also, again, as a sister in the work that we've all done, and she's been doing this for many years. She was the first African-American and Democratic woman elected into the Ohio Senate from Central Ohio. Her legacy in health equity and cultural competency spans decades, and her impact can be felt across this state. She poured wisdom into my journey and to so many others, so I'm just so thankful for her as she continues to do it, although she's no longer in the legislature. Please help me welcome and introduce Senator Charlita Tavares to share her perspective on Ohio struggle and Black maternal health. Thank you.
My sister in the struggle. I want to thank, first of all, Senators Ingram and Hicks Hudson for inviting me to be your speaker today. I see a lot of friends in the room and I don't want to start calling people out, but I really appreciate that the Black Maternal Health Caucus is alive and well and lifting up the issues that are impacting the premature death and pain of moms, babies, and families. As we talked with the legislators on the previous panel, we talked about how we want all babies to live past their first birthday. But what we know is our Caucasian babies in the state of Ohio are doing much, much better than our African Black babies. The rate of death is still 2+ times for African Black babies. And we've got to keep that in mind. You can't spread the policies, you can't spread the resources to everyone if you know there is a segment of the population that is hurting the most, because you're never going to get there. And that's been part of our problem. I'm getting into my speech before I say my thank yous. First of all, I want to thank my friend, Shayla Davis. She has done an outstanding job, certainly moderating the panel, but I'm just very, very proud of her and the work that she's doing with the Ohio Legislative Black Caucus Foundation. As she said, it represents African Americans, but More importantly, it's lifting up the policy issues that impact communities of color. And it's the 501c3 that helps to do the education, to build the public policies that need to be addressed in this state, and to help legislators with the tools that they need as well. So I want to thank you for that wonderful introduction. I also want to thank all my friends. It's good to see my former colleagues and friends and community partners. One of my close friends, Angela Cornelius Dawson, who has been a champion with the Ohio Commission on Minority Health. I really, really appreciate all that she's done. She's continuing to lift up the issues for Black, brown, people of color in the state of Ohio. You know, we don't want to talk about DEI. We talked about that a couple minutes ago, like it's not something we should address. The only way this state gets better is if we address the populations that are hurting the most. If we fail to do that, this state will continue to be at the bottom of all 50 states. I want to take you back. The one thing I do want to reinforce is the importance of the Black Maternal Health Caucus. I don't know how many we have in the United States, but I would say that we are blessed and fortunate that women came together, and I think it really started in the Ohio House, came together, and this was before COVID, to lift up and develop a Black Maternal Health Caucus. And so I want to thank both Senators Ingram and Hicks Hudson, who were in the House at that time, for continuing their efforts to lift up this caucus. Yes, let's give them a round. I want to thank all of you for being here today, for gathering to discuss a matter of paramount importance, the history of Black maternal health and infant mortality, and the strides we've made from 2013 to 2025, particularly here in the state of Ohio. Giving you a little background of the history of Black maternal health and infant mortality. Historically, the Black community has faced significant disparities in maternal health and infant mortality. Many are calling it vitality because that's a nicer way to say death. Yeah. I choose to use mortality because it makes it clear. We're talking about the death of babies. For decades, Black women have been 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. This stark inequity has roots deeply entrenched in systemic racism, socioeconomic barriers, and the lack of access to quality health care. 2013, we had a bit of a wake-up call. Sometimes it takes crying out 7 times. Sometimes it takes crying out 50 times before people finally get it. Between 2013 and 2015, the issue of Black maternal health and infant mortality in Ohio came into sharp focus. And I was the one that gave that rallying cry. And I had a friend who heard me, and that was Senator Shannon Jones. Yes, give her a round of applause. Senator Jones was on the Finance Committee with me. There were only 2 of us, 2 women on the Finance Committee, the most important committee in the House or the Senate, and only 2 of us that were on that Finance Committee. I lifted the issue up around Black babies dying and that we needed to do something. She couldn't support my amendment in the committee, in the Finance Committee, but she pledged to me that she would work with me in the next General Assembly. I decided I was going to raise it up again on the floor of the Senate when we were discussing the budget and we were going to pass the budget on that day. I said, I've got to get this on the record so everybody hears that we are going to do something about Black maternal health. I raised it again. She got up on the floor and she said, I pledge to you, Senator Tavares, that I'm going to work with you in the next General Assembly to address infant mortality. She was true to her word, and she worked tirelessly to ensure that we went around the state having town halls and meetings and roundtables to bring the promising practices to light, to hear about what's going on with moms, those lived experiences with moms and the death of their babies. And then we came together and developed a plan. So Senator Jones and I led the efforts to focus on reducing inequities in mortality rates between African, Black, and white Caucasian babies with the creation of the Ohio Commission on Infant Mortality. The Ohio Commission on Infant Mortality, and that was created in 2014, had the goal of improving Ohio's infant mortality rate to help more Ohio babies celebrate their first birthdays. At the time the commission was created, Ohio ranked 46th in the nation for overall infant mortality and 50th for Black babies. Infant mortality is defined as the death of a live-born baby before his or her first birthday. Members of the commission that was created included legislators, directors, or their designees from a number of executive agencies and representatives from Ohio's hospitals and community-based programs. Representative Davis talked about our FQHCs and other health centers and clinics throughout the state of Ohio. The hospitals can't do it by themselves. People need choices. People need culturally appropriate services. Not all hospitals provide culturally appropriate services. Not all neighborhood health centers provide culturally appropriate services. So moms and their babies need to find the most appropriate connection, health provider for them. Members, I shared, the initial charge of the commission was to complete an inventory of state services and funding available to address infant mortality and make recommendations to the governor and the Ohio General Assembly. Senate Bill 332, which was a massive piece of legislation that Senator Jones and I introduced in the 131st General Assembly, implemented the recommendations from the commission, including developing better data practices, cultivating collaboration between state and local initiatives, conducting public awareness campaigns, developing screening tools to focus resources on the areas with the most pressing need, and addressing the social drivers of health. Many call it social determinants. Most of us have moved to the word drivers instead of determinants. The commission continues to meet at regular intervals to evaluate Ohio's progress and maintain focus on continued efforts to improve health outcomes for all of Ohio's children. Their efforts led to the creation, this is Senator Jones and myself, as I said, of the commission being created. And the Senate Bill 332, which while we were developing ideas for legislation, we continued to meet with community-based organizations, providers, moms, dads, interested parties throughout the state of Ohio, because we didn't want just a Columbus-focused piece of legislation. We didn't want just a Cleveland-focused. We wanted to go around the state and hear what's going on in the state of Ohio. Where are we making some inroads? What are some pilots that we can lift up, like we've talked about Cradle Cincinnati and Celebrate One. Danielle, it's good to see you. But we wanted to make sure that we were focusing in on those programs that could be replicated across the state. Maybe they needed more resources. Maybe they just needed to be lifted up so others throughout the state could take practices that they had and introduce them into their organizations. Another great one here in Central Ohio is Moms to Be. And we are very, very happy with some of the outcomes that these programs and these services have provided to moms and their babies. This period during the 2013, 2015 served as a wake-up call, prompting both public and private sectors to take immediate action. Between 2016 and 2018, there were other initiatives that came about. Various initiatives and interventions were launched to address the disparities. The Ohio Department of Health, in collaboration with community organizations, implemented several programs targeting prenatal care, education, and support for Black mothers. Programs such as the Ohio Equity Institute aim to identify and mitigate the social drivers of health that disproportionately affected Black women. Between 2019 and 2021, a number of other policy changes were introduced. We saw significant policy changes aimed at improving maternal health outcomes. The passing of the Maternal Health Accountability Act provided funding for maternal mortality review committees, which played a crucial role in identifying causes of maternal deaths and recommending preventative measures. Additionally, and we don't talk about this enough, the expansion of Medicaid coverage for postpartum care ensured that more Black women had access to necessary healthcare services after childbirth. During 2022 through 2025, we're continuing to build on the progress that was laid before us. Ohio has continued to build on the progress made in the previous years. And I want to give a special recognition and shout out to Governor DeWine. You know, many people talk the talk, but they don't walk the walk. And Governor DeWine has lifted up children and families every step of the way. The creation of the new Department of Children and Youth is a perfect example. He puts his money and his policies where his heart is. And his heart has always been on children and families. And so we need to give him a round of applause. The implementation of the Ohio Black Maternal Health Caucus has been instrumental in advocating for policies that address the unique needs of Black mothers. This period has also seen increased investment in community-based programs such as home visiting services and doula support. And I want to underscore doula support because the Black Maternal Health Caucus worked very, very hard to get that through. And we can't let that slip through during this budget process. So we've got to lift up doulas and the cost benefit analysis that Representative Holmes talked about. We've got to talk about the saved lives of Black moms and babies because of doula services. They've proven to improve maternal and infant health outcomes. Now, we're looking back, we've come a long way since 2013. The heightened awareness and commitment to addressing Black maternal health disparities have led to significant improvements, but it's not improvements all across the state. It's not improvements amongst all populations. We've got to keep the focus on where the hurt is the most. We've got to keep the focus on addressing that gap between Caucasian white babies and African Black babies. Because if we don't, our state is going to continue to bring up the rear. We're going to continue to lose lives. And so we've got to be the messengers. We've got to be that group that talks about this issue over and over and over. We've got to drive the political will in this state to do what we know we need to do in order to get better health outcomes for all babies in the state of Ohio and not at different rates. Looking back, we've come a long way since 2013. As I said, the heightened awareness and commitment to addressing Black maternal health disparities have led to some significant improvements. Community engagement, policy changes, and a focus on social drivers of health have all played a vital role in this journey. We've got to continue. Despite the progress made, we must acknowledge that there is still work to be done. The fight for equity in maternal health is ongoing, and we must remain vigilant in our efforts to ensure that every Black mother and child has access to the care and support that they deserve. One of the most heartening aspects of our journey has been the success stories that have emerged. Community-based initiatives, as I said, like Celebrate One, Moms to Be programs in Columbus, Cradle Cincinnati, Centering Pregnancy, and others throughout the state. Cleveland has excellent programs that are lifting up moms and babies. Toledo has programs that are lifting up moms and babies. They've shown remarkable results in reducing infant mortality rates among Black infants. These programs have provided comprehensive support to mothers from prenatal care to postpartum services, demonstrating the power of community-driven solutions. In addition, the regional pathways community hubs, which have been lifted up by the Ohio Commission on Minority Health. We can't underestimate all of those drivers that have been initiated through a spoken wheel model that was started in the state of Ohio. And we didn't even lift it up. We didn't even lift it up. We had to wait until, what was the name of that organization? Well, yes, it was the CHAP program out of Mansfield, Ohio, that started the Pathways Community Hub. And it was the Reddings, the doctors that had started the CHAP program. But we had to wait till others throughout the nation lifted up this program before we would take and use it ourselves. The poor little doctors were going around advocating for this program to help moms and babies, and we weren't listening. Our ears were shut because guess what? They were from Ohio and they couldn't have had this phenomenal program that was going to help moms and babies. And now others throughout the nation are using this model to connect moms to the services that they need and to make sure that they're true connections with pay for performance. As the representative talked about the cost benefit, you're going to get paid when you perform, when your outcomes show that you're making a difference for moms and babies. That's important. So the Pathways Community Hub, as I said, is nationally recognized and it was started in Ohio. Now, the role of healthcare providers. Healthcare providers have also played a crucial role in this progress by prioritizing, and I'm going to underscore, by prioritizing cultural competency and humility training and addressing implicit bias. Providers who have participated, underscored, providers who have participated in these efforts have become better equipped to deliver quality care to Black mothers. The establishment of birthing centers that cater specifically to the needs of Black women has further contributed to improved outcomes. I'm going to underscore understanding and being culturally appropriate in the way you provide services. Because if you don't, that patient isn't coming back, or that patient isn't going to listen to what you say. You know, I had the misfortune of speaking to a group of cardiologists at an institution brought in by a cardiologist to talk about cultural competence and why it was so important. And the head of the program basically said, oh, I did that training. You know, it was like I checked it off. And that was the attitude. You know, I've done that. Well, it's not a one-time thing. It's not a check-off box that you do one training and now you know how to treat everybody who looks different than you, who comes out of a different experience. And then I have people that say, I don't see color. Well, that shows me you're not culturally appropriate because you need to see color. You need to see culture. You need to see that Appalachian mother who's coming in for care. You've got to understand her way of thinking, her traditions. Otherwise, you're going to miss the boat and you're going to either misdiagnose or mistreat her. So when somebody says they don't see color, that's a warning sign right then and there. When you don't see color, you don't see me. That's what you're telling me. That's what you're telling me. I want you to see my color. I want you to see what's different about me, but I also want you to see what's the same about me. And I want you to be appropriate in how you serve me. Because what's good for one, just like the old saying, you know, do unto others as you would have them do unto you. I don't want you to do what you do to yourself, to me. Because what you may think is appropriate is not what I think is appropriate. So pay attention. And that's why providers are critically important. If they're not interested in cultural humility, they're not interested in serving people of various racial, ethnic, and cultural communities in the state of Ohio. And they need to be either taken to the woodshed or they need to be removed. These are my words. I can say what I want. Looking ahead, as we look ahead, it's imperative that we continue to build on the foundation that we have established. The commitment to reducing health inequities must remain unwavering. We must continue to advocate for policies that support Black maternal health, invest in community-based programs, and ensure that healthcare providers are equipped to deliver culturally competent care. In conclusion, the journey from 2013 through 2025 in addressing Black maternal health and infant mortality in Ohio have been marked by significant progress and meaningful change. While we celebrate our accomplishments, we must also recognize that there's great work that lies ahead. Together we can and we will create a future that ensures that every Black mother and child has the opportunity to live and thrive. Thank you all very, very much.
Say something just because I can. I want to make sure that I recognize that Senator Coonsey is here. And Senator, thank you for all the work that you had already done. From the Minority Health Commission, oh yeah, that's right, you're a commission. Is here, Angela Dawson. And Gutierrez from Groundworks is here, and so I'm just while they're fixing whatever they're fixing.
Thank you, Senator Ingram. And so now we're gonna, I'm just gonna briefly mention two amazing women that I've just learned about today who wrote a book. They co-authored a book called Infant Mortality and Other Wicked Problems. Jill Miller is the president and CEO of Bethesda Inc., where she oversees the BI3 Fund, one of Ohio's most significant health equity grant makers. Her leadership has helped save hundreds of lives through initiatives in infant mortality preservation. She's also recognized as a national voice in truth-based philanthropy. Let's give a round of applause for Ms. Jill Miller, and if she can raise her hand. Her co-author in that book is Dr. Meredith Smith, who is the executive director of Cradle Cincinnati and founder of Queens Village, a safe space for Black mothers. She's also an advisor on state and federal maternal mental health task force and a professor at the University of Cincinnati College of Medicine. Can you wave your hand so we can all see you? We are going to take a brief 5-minute intermission as we need to get slides and things like that together, but I just wanted to recognize them and the book because they do have the book with us here today. So thank you guys so much. Give us 5 to 7 minutes and we'll round this thing right back up, okay? Thank you.
You like it?
So.
Okay, okay. Gina is right here. She's our jury. It's here. So she just like a couple weeks ago. And
I brought 10 copies.
so when I saw, I got. Okay. Because obviously LinkedIn wants to know we're together. So we- Sure. Yeah. So I'm sorry I wasn't able to come to the earlier ones, but Kita was here. So. I'm so glad to meet you in person. See you. But I heard so many things about you. Like, oh, you did excited. I mean, look, just bringing up my energy today. Are any of the folks who come here today? Are any of the folks? There is.
Narrative too.
One of the meetings.
I know. Say it again. Sorry. That would be great. I like that. I didn't think I saw you.
I'm trying to think.
People are impacted in the three, it's a grant maker in health. So this. I've been. How about you like?
It clicked in my brain, okay. Absolutely. Put it down. I know, I'm like, I didn't even see it. She's hilarious.
Oh, I'll make sure. You just. For mom. And I feel like, oh, he's paying. I'm trying to figure out what's our solution. They kind of. Can't separate the two. I'm trying to say that it comes so much money. I make sure that. Like I said, just here.
And then you have like the month.
Good job. I can, myself, like staff, like, we can all find your.
So you're listening to you can just help. Really can. So good seeing.
Well, I was like, I didn't remember, I didn't ever get Joyce. Okay, Joyce used to be up at the restaurant up on the street.
Sorry, thank you.
So. When she says, I'm in town, we're ready, I said, when I'm. And I'm there.
Trust me. She said. Yeah. I'll be there. Oh, you do need to. Say so. Good job. I got my list. I thought so, yeah.
I like the.
She knows. Oh, and I was. That's it, it's a different.
Oh my God, I know this. Y'all want to introduce to a minimum? I saw you.
Right, Michelle Birch, thank you. And you were full.
And so, well, see Shannon, because Shannon, I just like level. So I said, I tell her I'm gonna call.
She's, I hired her.
Like, I know, I feel like my mom's reaction after the birth of me was, days later, she's like, like she's got all the jackets and sweatshirt. So I was like, I know this. Not stupid. Like, I'm gonna get a little closet just for these items. And
Like a whole like she keeps.
you do it. She's in good company too. I believe you. And if at any point you want to talk through any of them today, I doubt in all the ways. I just think that they're
Get started at 11:20. Yeah, everyone, we start back at 11:20.
She did it, she loved it.
Casey, here, we're gonna start at 11.
You hear what I said?
Oh, my baby. That's scary.
When I was a little older, I was vacuuming it. That's my knock over stuff. So, knocks over all the babies. Vacuumed them up by accident. Lots of survived and turned it up. Like, this one is. Put it back. Found it. Oh, yeah.
Now I'm just gonna travel.
Never popped up to it.
I have most of my siblings.
So you said you don't have
Parents gave them to really interesting. I know people who like wear it.
Like, but what about for your child? I was like, I have no idea.
We didn't get lost.
Like, exactly. I'm like, I'm not sure. For 30 years ago. Like,
Yeah, there's something nice to keep. Something.
Yeah.
gave me all her.
Don't ask me for
Needed like my earlier. Give me all these.
You don't think I have my.
Yes, I will. You don't need it now.
I'm not
But like, for certain.
But yeah, oh my God.
Yeah.
To get both.
That's what. The one I started traveling. I'm just like, I was. I'm just like, but also like, how do we start? That's my game. What gets given? What you keep in contact. What if you feel like I wanna sit down.
That's true, right? Exactly.
There's some like.
We're going to get started. Ladies and gentlemen, can we take our seats? Ladies and gentlemen, can we take our seats, please?
Maybe that's why she.
As you can tell, Senator and I, we don't follow any script. We just do what we want to because we've grown. But I just wanted to, oh, thank you. But before, because people are coming in and out, I think it's really important that you know, really the powerhouses behind this event. Now, Senator and I, we're up here looking good, showing out, but the two, and more than just two, but the two folks that really led this for us are our aides, Amber McClendon. And I know where Deja is in the lobby.
There's Asia. There she is.
Oh, yay. And, as we were talking about earlier, we also need to make sure that we recognize the men who also helped. And out of my office, we had two, what I call them my twin towers. One is Joseph Carpenter, and Darius Bryant. And so I wanted to, acknowledge these young people, because not only did they do the yeoman's work of making sure folks knew how to get here, what to say, and all these other things, and kept us on track. They also have a passion for public service. They also care about you. So when you make those calls into our office, when you send those emails, know that that they are also looking to help us do our job. So again, I want you all to give these young people, stand up there in the back. So I want you to see who they are and thank them. And one other person who won't come in, but, and that's Ramona. Ramona's out in the foyer. She also is part of Senator Ingram's office and she's injured by helping us get this thing together today. So we want to just thank everyone for being here and thank them for the hard work that you've done.
Thank you.
Thank you.
We are back in session, ladies and gentlemen. And so where we left off, I introduced two amazing people in their book. We're going to now have them come up briefly to speak about their book. I'll come back up and we'll segue into our provider panel. So Jill Miller, if you would please come up, and Dr. Meredith Smith. Thank you so much.
So I feel like I'm among my people. This morning session has been amazing. I know all of you. I just want to thank you all for advocating for Ohio families and children. I can say I'm mid-career, and one of the things I'm most proud of is that 220 plus babies are alive today in Hamilton County because of the collective efforts of our community. That is 8 classrooms of children and continues to grow in number. So I want to also thank Senator Ingram and Senator Hicks Hudson for having us all here today to talk about this most important thing, which is saving babies. And not only saving babies, but saving mothers. So why did we name the title Infant Mortality and Wicked Problems? Well, one is Cincinnati has been on a journey since 2008 to reduce our high rate of infant mortality. So in 2011, Hamilton County had one of the highest infant mortality rates in the state, but also the second highest infant mortality rate in the nation compared to counties our size. And former Hamilton County Commissioner Todd Portune said enough. He gathered some key champions, Dr. Greensburg and Kelly, and really sought to figure out how we start to tackle this wicked problem. Infant mortality is a wicked problem. It is a problem with multiple complex interconnected factors that are difficult to understand and pinpoint, much less understand. There are many wicked problems. And so what we wanted to do was share our story to reduce our rate that is now on par with the national average at 5.5. And that has been a significant journey of many. So that story is told in the book. But Meredith and I wanted to take it a step further and say, okay, so how can we help other communities based on what we've learned? And so we created a framework that you can read throughout the book. You can read it cover to cover, or you can use it as a reference. But it's really about letting the data guide your way. So our infant mortality rate, the main cause was extreme preterm birth, was the leading cause of infant death. And more importantly, when you started to disaggregate the data, it was clear to see that Black babies were dying at 3 times the rate of white babies in Hamilton County. And so we wrote this book, one, to encourage communities to listen to those with lived experience, to listen to the women who are closest to this problem, because they have the solutions that they need to make their lives better. Secondly, we wanted to show that change is doable. So even a wicked problem should not scare us from trying to tackle it or put a dent into it. For example, our Black infant mortality rate in 2011, some neighborhoods as high as 18.9 per 1,000 live births. Today, we are showing progress that for the first time in history, Hamilton County's Black infant mortality rate is in the single digit at 9.0. The disparity is still unacceptable, and so there's still a lot of work to be done. But you have to celebrate progress along the way to continue the momentum and the movement. And then third, we wrote the book to save more lives. And I think Meredith and I have both decided on if we can save one more life by writing this book, it will have been worth our time and effort. So lots of great things in the book. A lot of it we've talked about today, from building a narrative. I really appreciate the one message. And so the one message in Cincinnati was every baby deserves to celebrate their first birthday. And I think that is kind of permeated throughout the state. It was so important to challenge our assumptions and get to the root causes. And by talking to Black women themselves, we realized it wasn't just about access to early prenatal care in the first 12 weeks. It was the social drivers that were affecting them. Mom wasn't late to her prenatal appointment because she wanted to be. She was late because she had to take 2 buses to get there. Or mom wasn't a no-show because she didn't care. She couldn't afford to leave work. So all of these underlying, but most importantly, it was mistrust of the healthcare system. And so we had to build that trust between our Black communities and our hospital systems. So we really got laser focused, and I appreciate that point being made several times today, which is if you focus on the largest disparity, you improve health outcomes for all. For all. When we work to improve and equality and safety for Black women in our hospitals, we improve it for everybody. But key and critical, and I'm going to turn it over to Meredith, was really focusing on Black moms and babes. And when we did that and really engaged Black women, we saw a more significant decline in our infant mortality rate. So trying something new, scaling what works. I'm going to let Meredith talk a few minutes around Queens Village, which some of you have probably heard about, as well as Mama Certified. And in this book, you will find that systems change is possible. And that is what is happening in Hamilton County. Meredith?
I'm gonna be brief and not like a Black pastor. My short of why I wrote this book is to cut my meetings in half, because people kept saying, "Can I talk to you for an hour?" I was like, kidding. The honest truth is that I wrote it because the story should be told. Black women did great work in Cincinnati. And thankfully, when a funder is kind enough to say, "Let's tell this story," you say, "Absolutely, I'm on the way." So I'm grateful to you. The Sword of the Queens Village work and the Mama Certified work will be on the next panel. So instead of repeating that to you, I will say it on the panel. It was just Black-led work. It's simple. It's happening all over the state. It's really excited that we're allowed to do that with dollars from the state in the middle of where we are now. So I just think that that is beautiful. I think the world where we can do what we want and then get paid to do it is another story on trust-based philanthropy. And I'm grateful to you, Jill, and the BI3 Fund, and Janae, and those folks who are allowing us to do that. When you put medical folks and caregivers with Black women and they collectively work together, you create systems change. And that is the Mama Certified work that we will talk about: badging, data sharing from hospital systems publicly, wild things that people are like, "You're not going to do that." And I was like, "You don't know me." And collectively we did. That's the short of it. So thank you. Buy the book. If you choose, there's no by choice.
Deja, were you going to lead the?
I was thinking that we would do a raffle with the lunch, so that we can put the numbers out, get people. Where are we on the schedule? Uh-oh.
It's time for the provider panel.
So I'm gonna now introduce.
We're doing 11:30. It's gonna take me a few minutes. Here's what I need everybody to do.
I'm here for it.
Write down on a piece of paper a number. Now, as you see, I have multiple copies. Ladies, I've just kind of taken over your. I have multiple copies and they have been signed by the officer. So you write down your number. Now, because I have multiple copies, you can either keep your number or you can change your number on each draw. Each book has a number in it. Whoever gets the number exactly or is close to it. I mean by one or two numbers, not it's 15 and you've got 20. Huh?
100, what's the range?
Oh, it's up from 1 to 50, sorry.
I will note that if you do not win one of the free books that we've brought here today, you can purchase the book on Amazon. And if you are boycotting Amazon, then you can buy directly through BI3.
Okay.
Yeah,
Yeah, I want because I'm watching you. Deja, you and Amber, this is what you could do. You can watch these people, make sure they don't change their numbers. Now, remember, there's, how many books over there?
5, and one in your hand makes 6.
Okay. No, you don't get 2 numbers unless you keep it for the next one.
Oh, that's my number she was telling me.
Okay,
We only get to pick one.
first number is, oh, wow, now what happens if somebody gets the same number?
Exactly.
Rock, paper, scissors. Rock, paper, scissors.
We'll do, first number is, let me see everybody's number, kind of hold it up so I can make sure you get it. First number is 15.
Is that your number?
Oh my gosh, let me see.
Paper, scissors.
You got 15?
I don't know what we're doing.
You got 15? I got a 15 here. Do we have a 15?
I have to see it.
Don't trust him.
I'm a talk show host now. We have 2.
Paper, scissors.
Wait a minute, should I just give them both one?
Yes.
It says yes. That makes me have to get away with my other numbers. Okay. Darn threw me all out of whack. Oh, well, here, never mind then. What's the next number, Shayla?
The next number.
Hold your, I want to see numbers. You guys that already won can't get anything. If you never-
9. The number is 9. I got 10.
Oh, there we go.
She got the 9. Exactly the 9.
Go give it to her, check her number.
I can't see.
It kind of looks like a 7 there.
Hey, it looked like a 7. Okay, 1 through 50 numbers. Let me see. This number is 41. No way. I love it. I love it. 41. 41.
Checking.
She does. I'm verified.
Yeah.
All right, I'm gonna hurry because I'm in the way.
Like
Let me see your numbers. The next number is 50.
It's a 47 over here.
That's not close enough. I said 2 numbers. 50. But it's not the same. It'll be anywhere close to 2 numbers.
Will someone have 49?
Am I allowed to jump in? Yeah. Oh, does somebody have 49? 48? She will be the closest, or we start over? 47? You're 47? 47. Reluctantly. Sorry. This is what you get when you try to run stuff and it's none of your business. I tried to tell her, y'all. Both have 47 now. That's not fair because the number was 50. And I've given them both, then someone pick another number and just move on. Mel Stacy one. Go here, go give her.
I'll get one for Meredith if somebody else needs.
What was this next number?
There it is.
Number.
Let me see your number.
Verify. Anybody that don't let me. Anybody don't let me do stuff. Okay, the next number is the last one. 12.
To you.
12. At 13. You guys are so.
I had to know, but that's not the number I hit. I had a lot of numbers. Number I need.
But the number 13.
Yes.
All right, I'm finished for the day.
Thank you, Senator Ingram, for your book rally and raffle. It went great. Congratulations to everyone that won a book today. And thank you again, Jill and Dr. Meredith Smith, for bringing those books for us. So now we're going to turn this over to the people who are on the front lines, our providers. But this panel is being led by a leader I've worked with personally. And I know everybody personally, I keep saying. In 2012, I served as the director for the Cleveland Office of Minority Health. And I had the honor of working directly with my boss, Director Angela Dawson, who is the director and the executive director of the Ohio Commission on Minority Health, the first state agency of its kind in our nation. She is a force and fierce advocate for culturally responsive care and a mentor to so many, including myself. She will be guiding this important conversation for all of the panelists. I will briefly name them and she will personally introduce them. Again, we have Dr. Meredith Shockley Smith from Cradle Cincinnati, Dr. Kermie Dixon from Moms to Be Columbus, Dr. Stacy Scott, Babies First Network of Toledo, and my personal friend, Dana M. Langford, Village of Healing from Cleveland, Ohio, the loud city in Ohio. Welcome, Director Angela Dawson, and thank you so much.
Good morning.
Good morning.
I have a severe bilateral hearing impairment, which is a nice clinical way of saying she cannot hear. Good morning.
Good morning.
Thank you. Keep it at that volume. Thank you so much. Certainly, thank you to former Representative Ms. Shayla Davis. It's been a blessing and a pleasure to work with her throughout the years. I want to say to each of you, thank you so much for your presence today. Your presence today speaks volumes to the work that is yet ahead of us. I know we are gathering during Black Maternal Health Week in the middle of Minority Health Month. We must work every day, every week, every year, and every month on the issues of driving systemic change. Now, I know you see me standing here and your vision is correct, but behind me, and I want you to know, are so many individuals who have pushed this work
we can't stand at podiums and not talk about the shoulders that we stand on. The Commission on Minority Health hosted the first infant mortality summit in 1988. We have been clarion calling this issue from the leadership of former Senator Ray Miller to Senator, I'm not going to say former, am I? Senator Charlita Tavares, Senator Coonsey, Senator Ingram, and Senator Hicks Hudson. Thank you so much. It takes something to stand. It takes something to stand in an impossible area. It says that I am willing to take the front win. It says that I will stand in the gap. It says that I will stand if no one is standing. And I am so grateful that we together will be with individuals who have been standing. Allow me to bring these dynamic women up. I am so impressed and have been impressed and so grateful to learn of them and from them. I want to bring up my good friend, Dr. Stacy Scott. Baby First Network in Toledo, and Miss Dana Langford. She wrote winner for the Commission on Minority Health Award, and she is the CEO and medical director of the Village of Healing in Cleveland. Dr. Meredith Shockley Smith, executive director, Cradle Cincinnati, and founder of Cleveland Village, and Dr. Camilla Dixon, medical director of Moms to Be in Columbus. And I see you, Dr. Gabby. I see you, strong warrior. Thank you so much for your work. Now, you need to understand that this morning, the importance of the work that we do has continued to be stated. We cannot stop now. So that, remember when they say have one message? We cannot stop now. We must continue to go forward. So now I'll put on my hat. Hi, on behalf of the Ohio Commission on Minority Health, the board and staff, we bring you greetings from the commission. I want to acknowledge Ms. James, who is our program manager, and certainly Ms. Tracy Bell Thomas, board designee from the Department of Medicaid. So you need to understand that you are about to listen to what is the depth and experience. The legislative panel was very clear. Tell the story. But they also said something else. Let's talk about the data and the return on investment. So very briefly, let's talk about Black maternal health and the reality in Ohio. See, because the truth is that the Ohio infant mortality rate is 42 for Ohio. And that's 42 out of the 50 states, and 42 being the low number. Infant mortality in the state of Ohio in 2021 was 164%. Let me check your hearing. What percent? 164% higher for Black Ohioans than white Ohioans. So when you tell the story, you have to present the data, and yes, the slide deck will be available. Want to thank HPIO and their president, Amy Rowling McGee, for always being there to share the information and the slide deck as well as the data. The truth is, racial inequities also exist for maternal mortality. From 2008 to 2017, Black women were more than twice as likely to die from a pregnancy-related cause than white women. Maternal mortality is a severe complication with major health consequences that arises during or after labor and delivery. And here in this slide, you can see that non-Hispanic Black mothers experience severe maternal mortality at the highest rate of any racial group. More importantly, these inequities are not changed by economic status or by educational attainment. This becomes key in finding solutions. Now, when we look at disparities, oftentimes the general public believes that the driver of addressing that is in clinical care. And so we pour 95% of our budget into clinical care, which only accounts for 20% of change. We have to focus on the social drivers that are impacting our outcomes. As an example, you can see the leading causes of when we talk about that clinical focus: preterm birth, birth defects, low birth weight, and of course, accidents and injuries. But that's just the tip of the iceberg, because we full well know issues of poverty, issues of racism, issues of harmful working conditions, issues related to chronic health conditions, or intimate partner violence. These are varied, but it is the depth of the problem that we need to address. And policies that only deal at the surface will never have a long-term impact. When we look at the issues, we have to learn more. Look at the data and allow the data to drive the information that you share along with the important story. You have many documents that you can reference. There are white papers, there are recommendations that have spanned over 190 recommendations for policy change. Pick one, but we cannot stop now. So we want to make sure that when we look at these areas, that we are looking at what are the drivers. I am so honored to have had my shoulder to the wheel with so many of these women and the work and the progress that has been done. When we look at all that we have done in Ohio, from the significant investments, here's what we know: a rising tide lifts all boats. So when we invest, as Ms. Jill has shared, when we invest in those impacted the worst, then what happens is the tide rises, and those whose ships are in the best repair rise. And that is why we have seen such significant improvement in white infant mortality, because we made a decision to do a targeted investment in Black infant mortality. Now it's worth it. Here's what we know. We now have a specific business case for the state of Ohio. HPIO developed a business case that demonstrates when Ohio, I know it says if, I can read. When Ohio eliminates disparities, we could gain $79 billion in economic output each year. This is the business case for health equity. And that's just the beginning. We know that beyond the substantial impacts on people and communities of color in Ohio, disparities in outcome, such as life expectancy, maternal mortality, and overall health status, represent missed economic opportunities for Ohio's businesses, governments, and communities. Allowing these disparities to continue will only result in a more economically unstable and unhealthy Ohio. We know that improvement is possible. We know that Cincinnati is a leading example of that, from system change to on the ground change to health outcome change. But be clear, you all work across Ohio, and there are thousands of people who are working to make a difference. We know this is possible, and we will share this space with these outstanding women this morning as we engage with our panelists. So to start, I would ask each panelist to share an overview of your program, and I would absolutely love to hear how you came into this maternal and child space.
Well, really, we can end it. You just did our whole presentation. I mean, it's over. And mic drop, let's go.
Yes, I am Dr. Stacy Scott. I am the Executive Director of Baby First Network. We've been around probably close to 50 years. It was founded by a group of parents across the state who had lost children to sudden infant death syndrome. They were a series of support groups around the state, and they decided to come together not only to provide bereavement support, but to also be able to work towards what it would take to reduce the risk of a baby dying. Since then, we have now I served as the chair for Ohio Collaborative to Prevent Infant Mortality since 2018 with Dr. Greenberg, and just transitioned now more in an advisory role. We serve as the backbone for Ohio Collaborative to Prevent Infant Mortality. We now have a role of leadership members of over 800. And we're doing a series of things. So definitely I'll share with that in a moment. Yes.
Oh, okay. So my name is Dana Langford. I'm a certified nurse midwife by trade. I would like to acknowledge my midwives that are in the house today. Also acknowledging First Year Cleveland, who are our partners in Cleveland, Ohio, who I give them lots of trouble, but love them dearly. And so Village of Healing started in 2019 as a community development organization to decrease disparities and improve outcomes. Originally, when we started, we kicked off our first programming in the murder of George Floyd, Breonna Taylor. And as Black women having to show up to work every single day, listening to white women and white men allowed to have the conversation. And whenever we jumped in, we were immediately ruled as aggressive and unruly and things like that. But we were having to come home every single day to watch TV and hear what was being said. We wanted to create a safe space for Black women to process mental health. In that same time, City Lab and Bloomberg had come out with a study to say that Cleveland, Ohio was the worst place to live if you were a Black woman and second to last in healthcare outcomes. If you've ever been to Cleveland, Ohio, there are 3 very, very large hospital systems that take up about 30 to 40 blocks in the inner city of Cleveland. So you go in the front and you go out the back and make a right, you are in one of the poorest Black neighborhoods in Cleveland, and at every single turn of those hospital systems. So to hear that was disheartening, but we already knew it was the answer. As Black women working in the space, in hospital systems, we knew as caregivers, as patients, and as providers, that this was a toxic, traumatic experience for Black women to enter. And so what we wanted to do was do what everybody was telling us to do, follow the data. And the data said that when your provider looks like you, your outcomes are better, your disparities are decreased, and your patient satisfaction and your willingness to give informed consent goes up. So what did we do? We were exhausted with sitting in meetings, having conversations about infant and maternal mortality with no real solution. So we started the Village of Healing Center, which is the first and only in Northeast Ohio, Black-led, Black-focused, 100% Black medical team with Black providers taking care of Black patients. And what does that look like? Because we're learning now that we have to define what providers are to the community. Because when they see Black women with master's degrees behind their names providing medical care, it's hard for them to believe that these are actually Black providers. So what does that look like? We assess, we diagnose, we treat, and we prescribe for our patients. We started to see about 40 women. Our first year, we saw 460. And so we recognized there was a need. Since then, we've opened our second site in Cleveland, Ohio. And our third site is opening in Youngstown, Ohio at the end of this year. We've been blessed to see over 1,800 Black families. And thank you. In women's health, primary care, pediatrics, and mental health. And why? Because what we recognize with starting with women's health is that Black women were the CEOs of their families. And when they are healthy and when they are whole, that is the trickle down effect. The entire family from there becomes healthy and whole. And so we wanted to open up the doors to be able to see that. So what we saw was infant mortality decreased because we had healthy families, because we recognized that only 20% of what we did inside the doctor's office, like she just said, really truly affected healthcare. It was the 80% outside. So we transformed the way that we saw patients. And so what we've been able to accomplish now since we've opened our doors 3 years ago is a 92% full-term birth rate. Last year, 95%. And zero maternal deaths. So while we continue to say that, you know, Dr. Dawson said 92% goes back into clinical care, but they only do 20%. We have to transform what that clinical care looks like because we are the ones providing the care. And so when you transform that care, you will see the difference.
Okay, you got it. Got it. I don't know. I just kept pressing. I'm gonna, since we started with the midwives, I want to shout out my midwife who was in the building. Thank you, Jackie, who we were, had a free standing birth center way back when my kids were 21 and 22. So it's very cool, very cool. People circle. So back on Cradle Cincinnati, I'm the executive director, Meredith Smith. Meredith is fine. I don't need Dr. Smith, just some people attach or connect. What happened in Cincinnati is that about 12 years ago, they put a large grant in one neighborhood where Cincinnati Children's is. You can imagine Cincinnati Children's makes a lot of money. And the neighborhood in which it sat, babies were dying at an alarming rate. And so they put a large grant there. That grant came from BI3 Fund, who you heard from a little earlier, Jill, and part of that story is in the book. And what happened was they gave them the same doctor, they gave them a nurse case manager, community health worker, and they saw zero extreme preterm birth for 3 years. That is the data. We're talking about 10,000 births, 3,000 to 4,000 Black births. And that is what drove the number in Cincinnati so low. At the same time, Cradle Cincinnati was forming to be able to spread that one neighborhood work into an entire county. How do you take a very large grant, and I will not give you that number, in one neighborhood and make that look the same everywhere else? Scale is very hard, spread is very hard, and theory and practice is quite different. So what happened was Ryan, who was my predecessor, and 2 other people started to take that work and spread it along to Cincinnati. Infant mortality started to go down. We saw it go down for white women. We did not see it go down for the rest. So it was pretty steady for Asian women and Latino women, and Black infant mortality is quite stubborn. Enter me into this role wherein I said, I have an idea. How about we ask the people who are suffering with this problem, who are the most impacted by said problem, what they need, and let's do it. And some people were like, no one's ever going to pay for that, except BI3 said, sure, ask them. And then I'm like, what if they say something wild, like they want to go on a birthright trip to Ghana? Can we do that? And she was like, well, probably maybe not Ghana, but we can definitely figure out something. So we went, and I mean, that gift that BI3 said, I trust you to do this work, and I trust Black women to know what they need, was a beautiful thing I had never experienced. And I've been in the nonprofit world my entire life. That allowed us to see thousands of Black women, literally. I'm not going to throw out a number because my data person it's being recorded. Thousands of Black women to give their ideas and show up for their work. And when they were able to do that, they started with rest, relax, repower. I need to heal myself. And then they started with holding systems accountable. You must do change in order for in order for us to see change. And that happened in Hamilton County, and I cannot leave out Butler County, Queens Village, who's sitting in the front. Then that work spread from Hamilton County to 13 other counties in our nation, and we're drilling down really deeply in Cincinnati or in Ohio, which makes me want to shout out the other Cs. Shout out to First Year Cleveland and Celebrate One.
Thank you.
We've been thinking about it for a while, so it's exciting.
Hi, I'm Dr. Cami Dixon. I'm a practicing OBGYN and I'm the medical director of Moms to Be. First want to give a shout out to Dr. Pat, our founder of Moms to Be. And then also Mariah and Jason, part of a Moms to Be team here. So yay, for Moms to Be team. I also just want to say thank you for putting this event on. I think it's super important that we're talking about it, that we're all in the room and we're thinking about the health of Black babies and Black mothers. And especially in these times, I feel really thankful that we have this panel here and then we can share what we're doing to make sure that we continue this great work that's happened over the last decade. So Moms to Be was started in 2010 to address the infant mortality rate here in Ohio. We've already heard the rates. We know it's really, really, really bad. And it was started in a church with two women and really seeking what they needed in their lives, what support they had, what support they didn't have, and what we could do to really influence those outcomes. And as what's already been mentioned, we know most of it happens outside of the exam room. And as I said, as a practicing OBGYN, I know that. I get 15 minutes with my patients. Sometimes I push it. Actually, a lot of times I push it. So if you see me, I run late because I push it. But we don't get that much time, right? And to have a space like Moms to Be, where our moms can come and feel supported by our multidisciplinary team, including myself, we have nurses, we have social workers, we have early childhood educators, we have dietitians, we have patient navigators. So really kind of creating a full army, really, of people to support our moms as they go through their pregnancy, have their babies, and support them until their babies turn 1. It's just been such an amazing project and program to be part of. Over the course of the years, we've been in many neighborhoods, so we work really closely with Celebrate One, so shout out Celebrate One. We focus on the areas of Columbus that have the highest rates of infant mortality. We want to be where we're needed. And it's really important. Sometimes that shifts, thankfully. Sometimes we have neighborhoods where we have improvements and we go other neighborhoods, and that's what we need to do the work. Over this course of the time, we've served more than 4,000 moms and their families. And it's just amazing to be part of this. And as I said, I just feel like I tell my colleagues that I find it really amazing that I get to do this work. This is why I went into medicine. I was a teacher, and when I was teaching, I saw the disparities that my students face, the fact that they didn't have access to excellent healthcare. And I thought it was abysmal, and I wanted to be part of this change. And I feel really thankful that I get to do this every day. And I get paid to do it, which is really cool because I would do it for free, but don't tell people I would do it for free, because I would. So whatever, I'm clearly just really excited, and I'm happy to share this stage with so many wonderful providers. So
Thank you.
Yeah.
Dr. Scott, Medicaid expansion has provided coverage through the first year of postpartum. What is the immediate long-term impact if this coverage is eliminated from your perspective?
Well, I can start out by saying one word, it would be dire. I mean, what we see, and let me just tell you a little bit about Baby First Network. We provide bereavement and grief support to families who lose children. And it is amazing of the calls that we do get. We have worked very hard to work with Black families to encourage them to get bereavement support. We've done a whole piece on social determinants of grief and the inability for Black families to be able to grieve properly. So looking at the increased number of deaths that could happen as a result of Medicaid not providing its services is significant. And I don't think we always think about what is the end result of that, of the deaths that do happen. My concern is based on the number of deaths that we see that happen in the state, the limited amount of calls we receive from Black families that are definitely in need of support. So I would just say all of the things that everybody else could say in regards to not having that kind of support, looking at the number of deaths that happen through postpartum, not only for infants, but for moms and birthing people as well, would be significant and a travesty that I see happen across many states in which I work in. So thank you.
Thank you. We cannot stop now. Dr. Smith, this is a question from the audience. How should providers respond to the maternal mental health needs of Black mothers, including support for grief, trauma, and postpartum depression?
The providers do them?
Okay. Very good.
Okay. I'll give you my thoughts about what community is.
From the hospital systems.
That is the mic. What we have heard from our community members, queens, are saying mental health is shooting through the roof, and I don't know what to do. I don't see providers who look like me. I don't even know how to reach out. I'm tired, I'm overwhelmed, and I need support. So some of the answer to that is pipeline. We need to figure out putting some people in place. Some of the answer to that is education. How do I have access to that? The other piece is who is the person who's helping you? So I want to shout out community health workers. I don't know if there's anybody, or navigators, or people who are holding hands for folks who really need their hand held. I think the Army that you mentioned is kind of what I'm saying. So I think the development of considering all that is being paid for in our space. When we get to budget time, people are like clinging to dollars and cents. And I just want to always shout out the folks that rarely get to be in these rooms, who are doing work untold, from getting people from places to from postpartum depression through the first year of life, which is, you know, the lane that we are running in.
Thank you. Director Langford, how should hospital systems address the maternal mental health needs of patients?
So I'm very clear in that whenever we sit down, we have been truly blessed to be able to walk into the rooms of hospital systems. You know, originally when we started, they were like, oh, this is cute. And so now they're like, wait, we want to bring you to the table to have a conversation. But I'm very clear that hospital systems got to work on their own stuff. That, I mean, this system was created over 400 years ago to exclude Black people. It was very clear when it was created with racism in mind, allowing us to die in the streets after slavery because they didn't allow us in the systems. And now the work has to be done within the system to fix that first. And then we can talk about what that looks like for welcoming Black providers into those systems. I think in general, overall, what needs to happen as far as mental health, and it's this hospital systems, community health centers, because that is going to be the core of where we see truly infant and maternal mortality change. It's going to be in ambulatory centers and not within hospitals. It's like Dr. Smith said, or I'm sorry, Meredith said, we're gonna have to increase the pipeline first and foremost. And then it's that transformative care, right? It's that village care and that village concept. You know, at Village of Healing, we started our pediatric postpartum model where mom and baby are allowed to be seen together in the same appointment for the first year of the baby's life. And so when you talk about removing Medicaid in that first year, that's going to be detrimental, right? Because now these moms that usually after 6 weeks are dropped and walked away from are now given appointments where we assess mental health, or we assess cardiovascular disease. The top 2 reasons that we see Black women dying in that first year, we're able to do that all the way up into the first year at every single baby appointment. And so when we talk about mental health, We're able to do that, and immediately we have a conversation with our mental health providers. But we're fortunate enough to have those Black mental health providers that are a phone call away to be able to refer to. So what can hospitals do? Number one, invest in the pipeline to ensure that we get more Black providers. Number two, create welcoming systems to those providers. We thought when we created Village of Healing, it was just for patients, when in all actuality, it was for providers too. Providers run to us to slide us their resume on the back end, like, when you get open and let me know. Because of the traumatic and toxic experience that they have in the systems. And so we have to do that. And number three, hold the hospitals responsible. We continue to go to these hospital systems with our dollars, with our insurance. We don't have to. There are multiple other places to go, especially for mental health. There are a lot of Black mental health providers around the state that have created their own systems. Utilize those systems. Go where you're wanted. Go where your dollars are appreciated and where you'll get the most out of your dollar and where you get to see somebody that most importantly looks like you.
Thank you. Dr. Dixon, what do you think Ohio policymakers need to know about what it actually takes to achieve birth equity?
I think that is a really important question. I do think it ties into what we've already talked about as far as Medicaid. I would be remiss not to speak on that. I trained in Texas and I practiced at a federally qualified health center for 2 years in Texas. Texas did not expand Medicaid. So I was practicing in a place where I took care of patients. At the 6-week mark, they were dropped. So we had to, rush and try and get everything done in that 6-week mark. There were patients who couldn't qualify for Medicaid and their babies qualified for Medicaid. So I was taking care of a mom and the baby had the insurance, and just the detriment that did to their mental health, not being able to access care for asthma. When thinking about if you don't have care for the mom, you can't have the baby. But all that to say that when we expanded Medicaid, it's working in a place with expanded Medicaid through the first year. Oh my gosh, it is absolutely amazing to know that I don't have this rush when I have the patient in the postpartum visit, which usually is at the 5 or 6 week mark, to get everything pushed in that next day. So that is extremely important. And I really, really hope that doesn't go away, because I do think that we are going to see more deaths. We know that 53% of maternal mortality happens between day 7 and 365 after you give birth. So if those moms don't have access to the leading causes of death, cardiovascular health, and mental health services, then we're going to see more people die. And that is a huge, huge problem. So I do think that that is something extremely important to consider when we think about what we need to have in place for health equity. I also do think it's important to make sure that it's, okay, I'm just going to say it, in this space where we can't say certain things, right? We can't talk about certain people in certain ways, it's going to be a problem. Because if we don't know the problems that we have, we can't fix them. So we can't talk about disparities or inequities or say that this is the birth outcome for these people, then we can't fix it. So I think that that is really important to keep in mind as well. And then finally, I think, speaking to what we already said as far as creating a pipeline and a pathway, that is something that I've been really committed to in my career, making sure that we have providers that look like the patients that we serve. As a Black woman who, my son now is 11, I was blessed in that when I was in Texas, I had many options as far as who I could go to for someone who looked like me. And I know that currently with my patient base, I have patients who wait a full year to see me because there are not many of us. And that needs to change. So I do that through mentoring. We do that through making sure that there are scholarships and things like that. And then even in our department, really trying to expand what our providers look like. But all that can be really supported through our state and our federal government if they choose. So I think that that is super important as well.
Dr. Scott, what role, this is a question from the audience, what role should providers play in promoting system-wide accountability and advocacy for maternal health equity?
And are you saying providers just in whole or whatever? Okay. So let me just step back for a minute for me. And I'm kind of like Meredith here as far as providers. Our role and what we do within our organization is community. And that our goal is to educate the community as a means for them to be able to educate the providers. Knowing what they need, what they want, what they desire. And so we are doing a whole host of things in that arena. For example, we're providing many grants to community-based organizations that are encouraging them to work with clinical partners. We are funding, and they're small, $1,500 mini grants, and we're asking the community to work with at least 30 people within their community to promote things in an effort to reduce infant mortality and maternal mortality. I also, in my other role, we received $6.9 million from Blue Meridian Foundation that is starting the community-centered hospital initiative. That's doing exactly what you're saying in regards to being able to have communities take the lead. The communities have the table, they're setting the table, and they're asking hospitals to come to their table. Kind of just a different switch, and so with that, Ohio, we have had the ability to provide $30,000 to Ocpen to be able to start this initiative. We've been doing this since December, and it's been great. We are also now in Mississippi and Kansas as well. And so our hope and goal is by educating the community, which we feel is going to be key as we see what has happened to our good government jobs. What we have seen, the gutting of the CDC, even that Hear Her campaign, that there's nobody there manning the lines. And just looking at it from a national and federal perspective, that we have to rely on the communities to be able to continue this work. And we need them to be able to provide support and a buy-in for them to understand that they have a voice, and help them, not empower them. I hate that term. We're going to empower. What we're saying is we want them to realize the power they have as a result of, again, the resilience that they've had surviving enslavement, Jim Crow, and all of the other things that we have had to endure. That yes, we look at infant mortality, but we also look at infant survival. And what are the key things that has allowed our babies to survive based on the community, based on that. So these are the things that I appreciate.
Dr. Scott, you spoke to community support. As we come to the final question, if each panelist could answer this. This work is more often than not challenging and all uphill. And as we engage with fellow soldiers in this process, can you share what you do to keep yourself balanced, to keep going? In other words, what motivates the motivator? So if each of you could share briefly, because I think, people can get to a point of exhaustion.
Oh,
And
yeah.
we really have to make sure that we continue to take care of ourselves as well. Thank you.
So I'm gonna jump in here because I did a 2-hour ride here just about 30 minutes ago. And these last 2 weeks for me have been extremely difficult. I knew in September when they announced the amazing, brilliant Kamala Harris for presidency run, that America was never going to put a Black woman in office. So immediately I started preparing myself for the letdown because I didn't want to be let down on actual election day. And so we knew what the end result would be. We knew funding would, come short. We knew we would have to, I've been getting calls, we need to change our literature. We need to change our conversations. Shouts out to my team from Schumacher that came out to support me today. I reached out to them and was like, what is the conversations that I need to have? So the last 2 weeks have been extremely difficult as we've had funding put on hold for Medicaid. As we have, large grants that were coming down for Medicaid are now on hold as well. The 2 weeks have been very, very difficult. You have to surround yourself, first and foremost, God. Let me tell you, my spirituality, my God has gotten me through. I sat in church on Sunday. I told somebody, I ain't heard Jesus be killed like that, in the grave and raised like that, like my pastor did. Like he had been watching me the last 2 weeks. It was like, this is strictly fire. So my spirituality, but secondly, the people you surround yourself with. You have to surround yourself with people that understand that struggle, that understand your daily life and your daily fight, and that pour back into you. And I say that because today I was on the phone with one of my friends who spoke into myself for about 45 minutes of that ride, just truly believing in me and speaking into myself. And one thing she said was, your mission of anticipation. And so that blessed my soul so because I know in the end, all of this is gonna work out. All of this is gonna be fine. And I just had this conversation with former State Rep Davis on the phone this week. She's one of the people that I've surrounded myself with. Like, in the end, we gonna be fine. But to go through it, I wish I could cuss up here. This is painful.
Yes, yes.
This is painful. Yes. Yeah, you gotta cuss it out. And so this is painful. And the 4 women that sit up here, I think I speak for all of us, the sleepless nights, the dark days, the driving into whatever with whatever music. Mine might be Rick Ross one day, Kurt Franklin the next. Notorious Big, the driving in, knowing what you're facing. This is hard work. And I never thought just trying to say Black women deserve would get this much backlash, would be this hard, would be this difficult. Just to say my Black babies deserve to live. I never thought it would. So all of that to say, number one, my spirituality. Number 2, the Black women I choose to surround myself with and who allow me to be in their lives every single day and have accepted the challenge, because it is with me.
Thank you. Thank
To
you.
be in my
Yes. Others. Dr. Scott.
There it is. It's on. It's on.
It's on now. Okay, there we go. It's on. So just very briefly, I want to say, and I'm gonna get a little meta on you, but in my studies, I have embraced this whole Afrofuturism theory and framework that really is an Afro-surrealism that really talks about the fact that the future is now. And that the fact is that we learn from the past, we work in the present
Yes.
to impact the future. And what the whole concept is from these particular frameworks that I've been studying is that the world as we know it will end. And it's okay, because the issue is that are we prepared to rebuild it and rebuild it in a way that we have the social justice framework that cannot be torn down, just like racism couldn't be torn down before the world ended. And that is the thing. We are upset about systems. We're upset about the words DEI. We don't even recognize that health equity and DEI is completely different, and all of these things. And so it is important that we, all of us, are prepared to be the architects of the new world that is going to be built as a result of what we're seeing now. And that is the hope that keeps me up in the morning and keeps me going during the day. I have my colleague, Michelle Edison, who is working with me on this big project that we're doing now. And we built that whole project on that Afro-surrealism framework that we were able to get funded. And it's just been amazing. So I say that, and of course, all the things that you mentioned, having people. For me, again, not being isolated, because it's easy to do that, but I do all of that. I stay awake at night. I try to figure out what I'm doing, but I just keep the faith and I hold on, and I know that this too shall pass.
Yes.
So y'all preaching, I'm gonna try to follow that. I stay inside. I don't know if you know, the kids are like, I'm outside. I'm like, I'm inside alone, chilling. That's what I do. I also have gotten to know, like, it's just not, you can't be everywhere all the time. And I am a person who wants to show up for you and show up for the work and show up for Black women always. And so I got to know here in the last little bit for sure. I have a very small group of people who I love. When Michelle Obama said this, everybody's like, I go high. She was like, I go to hell first. And then I go back to the people that I don't know and I go high. So I also drop my burdens where I need to and leave them there. So that is important. And then somebody has some reasonable to say to me, like, maybe perhaps we should say this and not what you said when you got in this first room. So wise counsel. I also love, for the young folks, again, the memes and GIFs that are out that are like, I don't know what y'all are doing, but I'm over here learning my line dance. And I am on the line dance. Well, I got fans for days. And that's what I'm doing with myself for self-care. And gratitude. I think when I live in gratitude, there's space for more great things to happen. So I try to say thank you to everybody always. Like, thank you for bringing us here. Thank you for creating this space. Thank you for the work and the outcomes. I just feel grateful. And when I leave here, I'm going back inside with my fan.
Dr. Dixon.
Yeah, I mean, like I to go last after all that, which was wonderful. No, I mean, I think kind of some of the resounding things kind of similar to me. I feel really lucky that I get to work with amazing people day to day. And I think that does motivate me, because the teams of people who I work with are so dedicated and motivated and care so deeply for the people that we serve, that fuels me. And then I think about the people that I get to serve, the people I get to treat in my office, the people I get to work with at Moms to Be, and the trust that they put in me. That is invigorating. And then finally, I do some of the other stuff. I do some cussing. I do. You have to do it, right? I love my music. I will go see my shows. I will go dance, and then I'll come back and do the work. And that's what I do.
Thank you so much. And now you see why they were selected to present on the panel today. Allow me to bring back up our wonderful mistress of ceremonies, former Representative Sheila Davis.
Thank you, panelists, providers, for all that you do. I've learned so much here today, and I've been even more inspired to continue the fight. So thank you all. And I hope, no, I don't hope. I know that I will now have the opportunity to work with each and every last one of you across the state. So thank you for that. Now, I'm going to call up the two wonderful ladies who run the Black Maternal Health Caucus. Senator Catherine Ingram.
You meant Deja and Amber.
Basically, because after the way you handled that whole book thing, I don't know. But and Senator Hicks Hudson from Toledo is going to come up and give us a closeout. I just want to say thank you all for allowing me to be the MC today. Thank you all for being here. Let's continue to do the work. Ladies.
Thank you, Rep. Davis. Thank you for the work that you have done, and even to be here today. And let me say this for all you folks that took a ride to get here. Thank you so much. It's a boring drive, no matter what direction you come. It's like going to Columbus, like, oh, man. But thank you. I truly, truly appreciate you being here. And we've got work to do. And the interesting thing about it, as Senator Tavares talked about, they've been doing this for a while. And many of you providers, 2013 and 50 years and all of the work that we've been doing, you've been doing, will eventually get to wake folks up. It's not go back to bed and pull the covers over your head. We can't do that. We also can't roll over and say, oh, well. So all of that work that you have been doing, guess what? You're going to do more. And for those of you who don't have a fan, where your fan at? For those of you who don't have a fan, you'll figure something out. And we'll have to work this out together. So thank you so much, my colleague.
As always, I am humble and I'm honored that each and every one of you decided to come and be a part of this inaugural summit. We have a lot of work to do, but I don't know if you heard, but I did. We also have a lot of resources and strength. And I think more than anything else is that I want each of you, before you leave, to make sure you've met somebody new from another part of the state of Ohio. Because one of the things that helps us is to be able to take the information and be able to say that maybe it happened in Cleveland, but it also can work in Franklin County. Maybe it can work in Butler County, and I can take it back to Lucas. There are things that we can do if we collaborate. And I'm going to leave you with this, which is what I like my sister talked about, is this looking at the past, being in the present, but figuring out how to use these resources from the past to go forward. We are in troubling times. We are in a time of also opportunities. And so Langston Hughes in 1922 wrote that poem, Life. It's called Mothers to Son. So I'm going to, instead of using the word son, I'm going to use the word us. Well, us. I'll tell you, life for me ain't been no crystal stair. I had tackled in it and its splinters and boards torn up and places with no carpet on the floor, bare. But all the time I've been a climbing on and reaching landings and turning corners and sometimes going in the dark when there ain't been no light. So don't you turn back. Don't you sit down on the steps because you find it's kind of hard. Don't you fall now, for I'm still a going, honey. I'm still climbing. And life for me ain't been no crystal stairs. So the women and the families that you are all touching, they've had this experience. We're having this experience now, but we can continue to climb and we can make, and our commitment to you is to help you on the ground where you are doing what you are doing and helping you to be the voice, but you got to talk to us. So I want to thank each and every one of you. I want to thank the sponsors. I want to thank, as Senator says, Dejan and Amber, because they kept us on point. But last but not least, I want to thank our wonderful MC, who, when we talked about putting this together, she said, how can I help? How can I be a part of this? How can I change my plans to become part of a larger plan? And so Rep. Davis, I want to personally thank you publicly for that.
That means pick a number 1 to 20. No. And you might get a book. But I do want to make sure that you look at that back page that lists all of our sponsors, because without it, this day probably would have happened, wouldn't have been nice. You would be hungry, because right now lunch is outside. We do have a press conference. It's going to take place. It's supposed to start at 2:00. Is it 2:00? At 2:00. Anybody that wants to come over, we're going to be in the Harding Room over at the State House. Would love to have everybody over there. Anybody want to just speak and shout out, whatever, This is about making sure that we are heard. And everybody, when it comes to that budget, if you don't have a line item in there, don't worry so much about not having a line with your name on it. Do pay attention to where the money goes.
Yes.
If you follow the money, that's the important piece, because it could be in any department, could be Medicaid. They may not have a line item for you. Could be children and youth. They may not have a line item with your name on it, but it does still mean that that work that's important is going to be done, and you'll be the people who'll be doing it. So do pay attention. I guess, Deja, you and Amber want to say something? You've been talking all this time.
Yeah. Well, thank you all for being here. I receive our.
You can come up front if you want to.
Yeah, come up.
I'll let you. I was just kidding. I was just kidding. They'll be talking, oh my God, that lady, she was terrible.
Well, thank, oh.
Bingo. Okay, we'll have an announcement just briefly about lunches, but we do want to say thank you to everyone who comes, who always joins the Zooms, all the work that you do, and the knowledge that you bring, not only of metrics and data, but also of that lived experience that we've heard time and time again really is so important. Like, there's never a time when those stories are not impactful, are not meaningful, do not have the power to get us through the door, which we are seeing happening slowly but surely across Ohio. So thank you for coming, and then I'll hand it off to Deja.
Yeah, just thanks again for everyone to be here. I've been talking to a few of you all, like seeing you in person, because I know a lot of you are very faithful in joining our Zoom calls every month. If you're not on the list, we can certainly get you on there. I do have their emails, if you email their offices, it's last name at ohiosenate.gov, so we can get you on the list. And yeah, I was an intern actually for the Black Maternal Health Caucus in 2019 when you all were creating it. So I had the privilege to witness that, but then COVID happened. So it's like a full circle moment to be here today. And so thank you all. And there are, lots of lunches. So.
And one last thing, we're going to, because if you are here because someone told you and we didn't email you directly, please let us know, because this is the beginning of a conversation. It is not the end. So please let Deja or Amber have your contact information. And I hope that you will, during the time that you eat, that you will share information with others, because there is a lot of wealth here. So if there's nothing further, again, thank you so very much, and lunch is served.
And just quickly, there are vegetarian options for people who need them.
Yeah.
I wanted to make sure.
It's a great
Absolutely love it.
The strategic plan.
I just want to say hello. And I don't know what was more impressive, how good you did up there or.
Yeah.
Area.
Oh, same for lunch.
Yeah.
Not like a.
Although, like, it's so funny, I'd be like, you're coming right back.
And then you save it as. I always think. I saw that. It's a good option.
Oh, yeah. Oh, my sister should have reached out and she hasn't.
I will so.
Probably not your opinion, but I probably heard.
Still. Let me know if. Oh, no, I'm not that. Have a good day. Did you see AJ? That's why they get the questions on the. It's like I. I'm like. I got the recommendation. Oh my God. So we never come. He has never cut a head. We want the dollars. Right. They should. We're gonna get the. It's amazing. Wow. And I wanted to go. Okay, I know. Exactly. Like I agree. Right, that's right. Yeah. Okay. So I'm a. It's going to. You're like tremendous. Whoever. Well, no, and they prior to this. Appalachian. I did, and I thought. They don't say that in diverse. They don't like. There we go. Like it's. Take your pictures. Do a better time. Yes. So now. Oh, I love it. She's gonna try to get. I look stupid. Okay. Can I send it to you after? You get a. And watch yours. I'll be the backup. Good. For years. In line. Let me know. I want to hear. When you're. Well, yeah. 3, 2. I love that. Look over here. Thank you. Being a real one. Picture with you right there. Well, exactly. Started something. When
Get to him. Have some conversation. Okay, you got it though.
Okay, we met Deja already. They were all.
I was gonna say, I don't have. Today.
No, we did. I know. You trust me? Like, yes.
And I love Sean.
Yeah. Sharita.
Wait, get in front of.
Come on, talking.
We want to be.
Yeah. Okay, else.
Different perspective. Like, you know, right, when he's on all these. But he was like, you know, they asked, I want.
Should we raise some chairs?
End up a bunch of.
All right. 2 and 1.
And,
One more. 3, 2, and
I love that you would make like eye contact.
No.
Everybody. That's what I do. Everybody, you are having.
one more.
Sorry.
Oh. 3, 2, and 1. More.
Man, where do you work?
You know, I know.
So you can.
Like super. Okay.
Come on, man.
Yeah. Only elected for the. That you are. Congratulations. There we go. Come on in and we're again. You are. I mean, basically. It's giving elected.
Right, Shayla.
Ma'am, I want to show it for you when you ask me. I'll show up for the nonsense. I'm seeing all of them. Absolutely.
I can take it on.
See you.
See you.
Oh, I'll see you.
2 or 3 on each.
She made sure. Wow, she came with the powerful.
Make sure you get something. If you don't hear.
You're ready.
Yeah, make sure.
No, you're good.
And I see.
Kyle.
You know what? One of my sorority sisters stopped me on Sunday. She said, "Oh, I saw that you like this." I love you. I did too. I ordered it here. She said it was one of her documents. Because I liked it. And I thought that's right. That's what it is. Because it was a
Dude.
well, yeah. So let me know what it is.
Association.
Yeah. So I don't know if I had to because some changes internally. I was just kind of looking and thinking to myself, you don't know how many thought this one and maybe I will. I've outlined, just trying to have a and I mentioned it. Because I feel like it was right.
Yeah, and so we have.
Love, that is love.
Trying to figure out like. Maybe a new
Direction.
Spend some money.
agency.
That's right.
They're aware of it.
What DDRIGU and where.
Is this your bag?
Stuff.
No, I think that was.
Yes, it is. One more time. I did it. One more time. You know, come on with you. Oh, I like walking. Sorry. You said it nice to me. That's my. There's some good things. That's not you. What am I getting? Like you break a thing that you have to say. Oh gosh. I didn't have one color. Oh.
Three, two, and one.
For a very long time. Good. Can I tell you this? I almost thought about the most ridiculous reality. I could rent a car to get to Columbus. Get to Cleveland and fly back up to go one way. It's real crazy. Like, we can meet in Chicago. If we're gonna drive 4 hours, but there, 2 times, you go all the way down and back. Set it in your hand. Okay. And then I'm in Columbus. Yeah, I know. Oh, definitely like, you're unreasonable. I was like, let me not be unreasonable. Bringing it up every time, like, remember? Exactly. I said, you can see it, because I know I'm doing a panel. I said, no, you have a whole, I'm reading the evening. Get on that, it was being recorded too. Just for the record, I'm reading. Like, nothing, not a thing, yes, yes. And it's actually good that I did it. I have to appreciate taking care of our lives. That's friendship. I'm talking about. It was great. That was friendship.
I'm gonna grab one.
Oh, shit. Call you tonight. Okay, call me tonight. Oh.
I've been a lobbyist. But the OBGYN association.
I mean, if we know somebody, yeah.